started in the pharmaceutical industry, and for the main part I worked for AstraZeneca. My initial work was commercial input into drug development. I then moved on into running organisations for the company around the business in Germany, in the Nordics, in Canada, and then ran AstraZeneca in the UK. Moving on then to run AstraZeneca in Southern Europe, right across the whole area there. And then I retired, and that didn't last long. It wasn't something for me just yet. And I got quickly involved by being approached by the Canadian government to do some work with them. At the same time, I came across some people I knew who were setting up a consultancy, and there were 5 of us at the start. And we sold it with 55 people in, just short of 4 years later. But in the middle of all that, and one of the best things I did was I joined the NHS as a non-executive director at Liverpool Heart and Chest Hospital. And I was there for 7 years with them. And of all the things that were going on, that was the one that I found the most rewarding. And I felt a little bit as well that my background might be of use. I made a choice at about year 7 to say that I'm going to get rid of doing all the other things that I do, and I'm going to focus on the NHS. My wife was very surprised. She couldn't understand why I would be taking the least paid job and the one that seems to take an awful lot of work, but that's what I did. And staying with the NHS, I made my mind up that I want to do more than this, and I wanted to apply for a job as a chair. And that's what I did. I applied for the job in WWL, Wrightington, Wigan and Leigh Hospital. And I've been here nearly 4 years now and enjoyed every single moment. It's been challenging and the rest, but it's been very, very rewarding. I think it's a very difficult one for chairs because many of them have spent a long career in a very silo approach to the NHS. So the changes that came with the ICBs and that came through in integrated working is a very, very different way of working for many in the organisations. I personally think that the system working is the way to go. It's our best opportunity to deliver to the nation the healthcare that they actually need. And so for the chair in the middle of all that, it means that you have to spread out your reach. So instead of just looking at the NHS and within the trust that you're working in, you're needing to look at the local authorities, making connections with social services, looking at the ICB itself, looking at educational groups, looking at your staff that work for you, or patients that you treat. And one very, very important group is the governors, of course, because they live and breathe in those areas. So it's a much wider catchment area that you ever had before. At the same time, you had to be careful not to be operational, but to understand the issues that stand out there so that you can hold the board truly to account in the new way of operating that we do now in the NHS. Well, one of the challenges at the moment for the NHS, of course, is financial, but it's no different from the rest of the public sector. And every one of us are going to have to take some of the difficult moves that we might have to do to keep in line. It's not easy. It's not easy for the chief executive to look at some of these changes, but at the same time, you need to keep health and safety in mind as we do this. I think actually, ultimately, we will have better ways of doing things. I think it will deliver through AI and other things we talk about. Yes, that's important. But I think the people within the organisation as well, we're all going to have to learn to be more able to move around and looking at different things. There should need more opportunities for different training facilities so people don't spend their whole career just in one focus in one area, but have opportunities to move around. I know I've done some of that myself, and I would say that that can be very rewarding for the individual. So a lot of change, a lot of things to think about, but I actually think if you get it right, the chair can make quite a difference. It's a very interesting question, and it's one I get asked a lot about how different it is to be a chair at an NHS trust compared to the senior positions you had in the commercial international sector. And actually, it's not that different in many ways. The most important part of it, wherever you're working, is to get people right. If you don't look after your people, then it's very difficult for them to look after the people that we are offering services for. So that is absolutely paramount, to listen, to understand what it is that they face, and to understand the things that would make a difference to them. And once you have the people right, the other important thing is to get the finances right. It's imperative that you have a robust financial basis so that you're able to work, that people aren't worrying about from day to day, but they know that they can move forward and know that they're sure that they'll be able to continue to offer the services that they do. It's a difficult thing at the moment, a challenging thing, because as the environment changes, as the focus of the NHS changes in terms of more system working, the skill sets that you would have been looking for only 3 or 4 years ago are not the skill sets that we'd be looking for now. And that's a difficult thing to do, because sometimes people looking to grow within an organisation aspire to be what we know to get onto the board, and that doesn't always follow, unfortunately, in that situation. But facing that is a difficult thing, but something you must do. For the chair, that your role with an executive is not direct, because it's the CEO who makes the appointment, but you work very closely with the CEO and the rest of the team to make sure that what are the skill sets we're looking for, what are the capabilities the individual got, and are we truly sure, is the way that the things are evolving, this is the right profile. Now, for WWL, Wrightington, Wigan and Leigh, we have the benefit of being a relatively small organisation, and I do mean benefit because it means that people coming up, new talent in the organisation coming through in some of the larger trusts in the country, it's difficult for them to get those board jobs just yet. But we give you the opportunity, because of the size, that we become an opportunity for people coming through like that. And that's brought us some really top talent, just the talent we need in the current environment. People say to me they might go in 4 or 5 years, when I'll say to them, well, they're great 4 or 5 years, great for them and great for us, because we've got people, talent, skills that we never would have got any other way. And so that's the first part of it. The second part of it is really to look at what happens when you get the people on top on your board. We want to make sure that you can create an environment where what you thought you saw, and when we're looking at all the CVs coming through, but when we're looking to bring people in, is actually going to come to fruition as they come to your board. And I believe very strongly that you need to create an environment where people, yes, it is challenging, but it's done so in a safe way, and that people feel comfortable to be able to air ideas and to make comments or to provide thoughts about what might be a good way forward. People say, well, you might need conflict. Well, it is conflict, but done in a different way. I would say 2 things. Firstly, listen. Listen to as many people as you can. Because the danger is, and this is somebody here who went wrong when I first became a non-executive, I came through with my own ideas, and they didn't always land particularly well. The important thing is to listen to the people who'll be working for you, the people who will be ultimately benefiting from what your people will do, to look at the people you now need to think about in terms of the system working that we approach, to make sure you make wide and important contacts. And I would take that as your primary thing when you come into the role. And after that, and only after that, then start to think about applying the learnings that you've had, because then you'll know this relates to what people in the community and the people who work for you know, that that is what is needed. The notion of looking at case studies for the non-executives started in about March, April last year. And this was when we were all challenged with a very financial piece that was being put on the table to us. And the concern that was raised by the chairs was, how are the NEDs going to deal with this? They will be responsible for many of these things, and they'll be dealing with higher levels of risk than they had done previously. We asked ourselves what they need, etc., but then pointed out that instead of us second guessing what they need, let's sit with them and ask them what they feel, the support they would want. I led that programme on behalf of the GM chairs, and it was interesting because yes, they did bring up finance and yes, the risks that are associated with that. But they brought up many other things as well, such as how do you deal with a situation where you've got a very senior executive in an organisation, well liked, but there are things going on that would be of concern. How do you manage those moments? What are the options to you and who should you go with and how would you work with that? And so we put those things together, and there were the things that we looked at were all based on actual things that had happened. We had to anonymise that so we couldn't name people, etc. But that's what they're based on. And so what the non-executives will be able to do is look at these case studies, see what happened, then as a group talk about how you may deal with that if that was something that was to happen, for instance, in your trust. It's quite interesting actually that one of some of the testing around with this is that there's always more than one answer to these things. But the important thing is that you get the benefit of consideration and potential alternatives as well. So hopefully this will be launched sometime around September of this year, probably through Northwest Leadership Academy meetings, so you get the benefit not only of seeing different challenges that have been in the past, but the opportunity to work with people from different backgrounds and different organisations from the ones you're used to. The Northwest Leadership Academy I found to be particularly useful for non-executives. Very recently they've been doing work with SIDs, with Senior Independent Directors, and that's such an important role, but sometimes one that's not fully understood and fully utilised. I know our SID went down to that meeting. They found it incredibly useful. They're building up a sort of network amongst themselves now. And that's the sort of thing when you're in a particular trust, even within just an ICB area, you can't get that sort of number of people together. But the Northwest Leadership Academy enables that sort of learning, enables that sort of diversity that you need when you're looking for answers to very difficult problems sometimes. And of course, then I've got to know them even better recently with working on the case studies for the non-executives. And it's been very helpful and a big learning experience for me as well, and all those who were involved.